Hi, in this video I'm going to be talking about supplements during breast cancer and its treatment. What are supplements? What are they good for? And what other things should you know about taking supplements during breast cancer? Supplements is a word we use to describe a lot of things that people take in addition to their food. So it's supplementing the diet. And in general, this refers to things like vitamins and minerals, and there are a host of other things that people are talking about when they use the word supplement, such as herbal preparations and other things you can get, for example, from a drugstore over the counter or from a health food store. They come in all sorts of things like shakes and capsules, gummies, tablets, etc. They can be added to food, like you can add supplements to a smoothie, for example, or they can be taken on their own. There are a few things to know about supplements. The first is that they're highly processed. So these are chemicals that are derived from natural substances for the most part, like plants or mushrooms or herbs, and then they're processed in a way that we can take them away from the way they were normally grown. So a shake or a capsule or a tablet is a different product from what one would get from taking the original plant. In that processing, a lot of the natural properties of normal nutrients in our diet are actually taken away from the particular vitamin or mineral. So the more we process things, the less healthy they tend to be. You may have heard of ultra-processed foods, for example, like cereals and snack food. Basically, supplements, while we don't consider them ultra-processed, they are taken from a natural compound or plant and then heavily processed and put into a capsule or tablet and taken away from the food. And it's important to know that this process rarely enhances the micronutrients, but rather usually detracts from the natural nutrients. So in general, we recommend that you get your vitamins and minerals through dietary sources, the way they were intended, in natural occurring form, in vegetables, fruits, etc. There are a couple exceptions. It can be really hard to get vitamin D from dietary sources. The best way to get vitamin D is in oily fish. And when you think about vitamin D enhanced or enriched milk or orange juice, that's a supplement of vitamin D. There are not a lot of naturally occurring sources of vitamin D. So that is one vitamin that we do recommend you supplement in order to preserve your bone health in particular and your immune system. It's hard to make vitamin D through the skin after the age of about 30. We're not very efficient at doing so. But in general, you really want to get vitamins and other micronutrients from food in the natural occurring way that they were created. A couple other things is that tests have been done on supplements available from health food stores and drugstores, and many studies have found that the capsule doesn't actually contain what it purports to contain. There are no quality standards for a lot of supplements. So they're not recommended by the FDA, and that means they're not regulated by the FDA. So there's very little testing of quality that's done on many supplements. I don't want to make a blanket statement, but in general, they're not held to the same standards as pharmaceuticals. Not to say that pharmaceuticals are necessarily good for the body, but at least we know what's in them. We know what's in a particular medication that's prescribed by your doctor, for example. Here's one other key thing to know about, in particular, antioxidants like vitamin E and vitamin C. These supplements can actually undo the effects of anti-cancer treatment. So a lot of chemotherapy and radiation therapy works through oxidation. And if you take antioxidants, you can actually protect the cancer cells from the very treatment that you're receiving to try to kill the cancer and help you improve your outcome. And a very well done study, population-based study that followed people prospectively, found that people who take antioxidant supplements were actually at higher risk of their cancer coming back despite receiving good treatment. So we theorized this for a long time, and in animal models it looked like antioxidants reversed the effects of anti-cancer treatment, but this was a very large study using patients' data and patient outcomes. So I've become even more convinced that taking antioxidants during cancer treatment is not in the best way to improve your odds of the treatment working for you. Now, I would like to make a note about why we want to take supplements. I think it's extremely understandable and totally commonsensical that we want to do something in addition to what the doctor's prescribing. So you're sitting there getting an IV or you're taking anti-cancer drugs by mouth, and you want to know, what can I do to make this work better? What can I do to take the best care of myself? You're already doing a lot. You're undergoing treatment under a physician's care, and what your body is doing is recovering from the effects of treatment. So if it's helpful to you to think about, what am I doing to participate in my care? You're doing everything. There are other things you can do to boost your immune system and your health, like exercise, sleeping, trying to manage stress. You can check out our other videos on stress management. Social health is really important for your overall well-being and your physical well-being as well as your social well-being. So being with people who hold you up, people who support you, getting enough sleep, avoiding smoking and other tobacco products, minimizing your alcohol intake. These are all sort of healthy lifestyle things you can do that don't require the use of supplements, again, with the exception of vitamin D. It's important to know that there's no supplement or vitamin that can prevent breast cancer or prevent cancer from coming back. You're doing everything right. You're doing everything under, your medical team's recommendation and taking the best care of yourself. I hope this has been helpful to you. If it has, click like and subscribe. That'll help you see other videos we make, and we're always making new content. It'll also help other people just like you find this video. And if you are interested in knowing what treatment options might be available for you, visit Yerbba.com for your personalized report.